When was the last time you checked your dog or cat's teeth? There is a good chance, just based on statistics, that everything ain't going right in there with your dog or your cat. And can I attest to this? All of the I've had so many cats, a few dogs in my adult life, and boy, oh boy, over and above everything else, the most common thread is dental health. And I fell into, when I was younger, I definitely fell into, we've talked about this before, the do everything your veterinarian says to do. Like, that was my mindset. I fed all of the different kibbles that were for sale behind the counter, did all the jabs, blah, 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 you name it. And I will tell you, my animals have been in those statistics of the animals in the United States, at least, where we have just some of the worst dental health in our pets. And if we think about, it's dental health, obesity, and the obesity is causing so many other diseases and illnesses. These are like some of the things that are plaguing our pets more than anything. Well, we're in February now, and February is Dental Health Awareness Month for pets in the veterinary profession. So I decided, I was blessed, to be honest with you, to have Dr. Katie Kangas join me for today's podcast episode. If you're not familiar with Dr. Katie Kangas, she has a veterinary practice in San Diego, California, and she is an absolutely lovely human being, I might say. I met her in person first at the AHVMA conference last year, and then kind of followed each other over to the Feed Real Summit because they were both in San Diego a few days apart in October last year. And she is just an incredible human being, a wonderful veterinarian. She spoke on the panel at the Feed Real Summit, and one of my biggest takeaways, there were so many takeaways from the Feed Real Summit. Two of my biggest ones. First was Amy Renz of Goodness Gracious, and I had her on the podcast already to talk to you about metabolic disease, which is something, again, we definitely need to talk more about just based on the statistics and the health of our pets. But for February, for dental health awareness with our pets, with our dogs and our cats, Dr. Katie Kangas on the panel spoke about dental care, and that is one of her specialties. And I had a pet peeve going into today's interview, and I'm not going to spoil it for you, but I found out it's also one of her pet peeves. Thank goodness, because sometimes we bring things up to people and we're like, do I tiptoe around this? What if I hate this and she loves this, or I love this and she hates this? You never know, right? So I tried not to tiptoe around it. I just went full force in. I don't like this. What do you think? And she doesn't like it either. And it's becoming more and more prevalent with our dogs, especially. I imagine there may be some cats rolled up into this as well, but gosh, I hope not. But anyway, we're going to talk more about that in today's episode of the Pet Parenting Reset. So regardless of how you feel about your pet's dental hygiene, their dental health, this is a really, really huge topic. And we just spoke about the actual hygiene part of it. We could get more into like the oral microbiome, which Dr. Katie Kangas did touch on just a little bit, but I think that deserves its own episode. We'll bring that at a later date. So for dental health awareness for our pets, please welcome with me to the Pet Parenting Reset, Dr. Katie Kangas. Have you tried training methods that just didn't work? Do you feel that your pet is not getting his or her nutritional needs met? Are illnesses and bad behavior your daily norm? You're going to want to join me on the Pet Parenting Reset, where you'll hear interesting and informative interviews and get solutions to all your pet problems. I'm your host, Jessica L. Fisher. Dr. Katie Kangas, thank you so much for joining me and being here to talk to my listeners. I'm so excited to have you. I got to meet you for the first time in San Diego last year, and you were just a ball of fun. So happy to have you on the podcast. We are going to talk a little bit today about dental health for our pets. But before we do that, you are an integrative veterinarian. You have a lot of experience under your belt. I'd like you to just say hi, introduce yourself, and maybe talk a little bit about how you wound up in that integrative field, incorporating holistic modalities into your pet's care.
Absolutely. Thank you. And I'll start off by saying thank you for the opportunity to join you today and to help contribute some, good topics of understanding for all your listeners, and kudos to all of your listeners for taking the time to, listen and learn. And we're all constantly learning, even integrative veterinarians I have 30 years of experience as a veterinarian, but I have more than 15 years experience as a holistic veterinarian. So, and that's I guess a good lead in to, kind of the question that you just asked, is to explain a little bit about my background. So again, my name is Dr. Katie Kangas, and my practice is integrative veterinary care, and I am in San Diego. And I have a lot of different things in my past that I did as a veterinarian. I started out actually doing exotics and wildlife and did some zoo work and some exotics clinic work. And then I fell into shelter medicine along the way. And that is very near and dear to my heart still, and, rescue groups and working with all of them. And I was the medical director of San Diego Humane Society and SPCA for several years back in the early 2000s. And at that time, my pet, her a black lab mix named Asti, she started having aging issues with mainly mobility and some weakness in her hind end, and started, falling down and having a lot of difficulty with her movement and even defecating and things like that. So I'd always been interested in holistic healthcare, or at least I had been for many years prior to that, but just didn't really know anybody personally, veterinarians that were practicing that way. And then, of course, as oftentimes our animals are our best teachers and our best inspirations, my dog Asti inspired me to, learn and move forward with finding somebody who could mentor me and learn more about being a holistic veterinarian. So, because we got such great results when I did find somebody, Dr. Keith Weingart, who is still, of course, I'm very, very close to, he was in my city at that time. And the results that I got with my dog Asti were extraordinary. And so I knew that I had to resign from my shelter position and go and learn, and started with acupuncture, branched out into nutrition, advanced food therapy, herbal therapy, took courses on homeopathy, et cetera, et cetera. So now my focus really kind of comes from a very comprehensive standpoint, having all of those sort of holistic modalities and trainings that I have, taken part in, that I really focus now on kind of a functional medicine approach, and bring all of those pieces and all of those tools into my support network for my patients. And so functional medicine, really, I love to describe as, finding the tools to help the pet's body or human's body function at optimum. So obviously the biggest tools are nutrition and food and diet. That's number one. But we can bring in other tools like herbs and homeopathy, et cetera, et cetera. And then the other part of functional medicine in supporting the body to work well and our pets' bodies to work well is also avoiding things that are causing compromise to the body, that are causing chronic inflammation and, disease conditions, et cetera, et cetera. So anyway, functional medicine is really my approach now, but bringing in all of those other facets. And along the way, I've had an exceptional amount of training in dentistry and dental health. So that has also been one of my special interests. I'm definitely into gut health and microbiome. And I mean, any holistic practitioner, I mean, that's a deep, love and passion of ours. But dental health happens to be another passion of mine. And once I was highly trained on the conventional side of understanding dental care for pets, I also was able to bring that into a wonderful understanding for anybody I get to, teach and talk to, and all my clients, in understanding that dental health and oral health affects the whole body 24/7. And so it is such an important piece of holistic health, whole body health, when we are investing in our pets' dental health and oral health. We are really investing in their whole body health, longevity, quality of life, etc. So it's really fun that, and I appreciate the fact that you suggested that to be our topic. Obviously, February is coming up. All veterinarians know that February has been sort of, coined as the dental care month, where pet dental care is much more promoted than other times of the year. But pet dental care is important always, but it's a perfect time of the year for us to bring this discussion into light. So thank you for suggesting this topic.
Yeah, well, I heard you at the Federal Summit last year already.
I know.
And you seemed so passionate about the dental health portion of everything that was being talked about on the panel, and I was like, this is going to be perfect. So thank you.
Absolutely.
So yeah, we talk on this podcast, we talk so much about nutrition, and I'm here for it because it's my favorite thing to talk about too. Like, I just can't learn enough about it. But yeah, because this episode will air in February. I did think it was going to be like the perfect time. It's on everybody's mind. It's flooding everybody's social media feed with dental health for their pets. And what I've found so interesting in my holistic journey, because my holistic journey started with my pets, and then I started adopting different, like, more holistic practices and caring for myself. And one of those things that I learned was with dentistry, and in realizing that I needed to seek out, I have a holistic dentist now, was that our human dentist, and I don't know, this could very well be the same for traditional vet med, it seems like they just don't understand the connection between the mouth and the rest of the body. It's like it's just this thing that you go in and clean, but they don't understand the connection that it has to the rest of the body. Can you maybe speak to that a little bit? Especially, I'm sure it's the same for us as it is for our pets.
Oh, absolutely. And so it is well known. And I mean, I think every dentist understands, because there are so many studies on literally the comorbidities of periodontal disease. So if a pet or a human, an animal or a human, has dental disease or periodontal disease, we know without a shadow of a doubt that the bacterial load and the chronic inflammation that is occurring in the oral tissues, the gingiva, and the deeper structures, below, like around the tooth root and in the jaw and things like that, we know that that is being shared via the bloodstream from the gums to the rest of the body. And most people have heard that, if you have a heart condition, periodontal disease definitely can, cause an issue, or you might have to worry about endocarditis if you have a mouth infection and you have a, cardiac issue. And back in the day, they used to tell people, and even pets, to take antibiotics prior to a veterinary procedure, or prior to a dental procedure, if there was a heart condition. That really, fortunately, has fallen out of favor now in light of the overuse of antibiotics and, driving antibiotic resistance and all that kind of stuff, which is good. But point being is, most people have heard along the way through the years that your heart can be affected by dental disease, your kidneys and your liver can be affected by dental disease. But now we know everything can. I mean, there's studies to show arthritis can get worse with dental disease. IBD and IBS can get worse. Brain problems, ADHD or cognition disorders, et cetera, et cetera. So we know it's really linked to everything, because the bloodstream is carrying, all of these factors to the whole rest of the body. And I think that every human dentist knows that, because they see these studies, they're taught this. But I love how you sort of brought that to light, Jessica, because I think most conventional doctors, whether it's a human doctor or a veterinary doctor, even though they know these things in the background, they're so trained to be sort of narrow tracked, a little narrow minded in their viewpoint of how they practice medicine, because they do get stuck in, this is the one category that I do. And sometimes the broad scope of the whole body health pattern sort of gets missed. And so I think dentists understand it, but I think they really miss, highlighting it or supporting it for people that they're treating. When it comes to integrative veterinarians, and kudos to you for finding a holistic dentist, human dentist. I also have a holistic or an integrative human dentist. So they do obviously procedures that a conventional dentist would do, but they also do other things that they wouldn't, and they would do different aspects of those treatments differently in a more holistic and natural supportive way. So for instance, like my dentist, and probably yours too, uses ozone therapy to, treat the gums, disinfect the gums, all that kind of stuff. They'll even inject ozone into, a root canal when they're doing a root canal procedure to disinfect that or treat that without having to use antibiotics, et cetera, et cetera. So it is really wonderful when you can find that resource. Unfortunately, to date, there isn't really, at least nobody that I'm aware of, although I'm sure it'll be on the horizon soon. But there aren't really holistic veterinary dentists available yet. But more and more veterinary dentists, or even just veterinarians in general, I mean, more and more of veterinary doctors are at least becoming aware and or interested in more natural means of supporting health. So, we got good stuff coming, but it's not like a pet parent can typically find a holistic dentist. However, I do recommend, when at all possible, for conventional veterinary care, dental care for pets, that a board certified veterinary dentist is absolutely optimal for dental care for pets, especially if there's anything advanced going on. And we can talk about this more, in our full discussion. But really, the level of dental care, certainly when it comes to surgical care, dental, which almost all dentistry care is surgical, the level of care that the pets will get from a specialist is by orders of magnitude, above what most general practitioners would be able to do. And that differs from our human dentists. I mean, obviously everybody knows that your MD, your general doctor, and your dentist, your DDS, credentialed person, completely different schooling. I mean, they went through years of school just to work with the mouth. And veterinarians, we have 4 years of, medical school after, undergraduate years. And we literally get 1 to 2 months of dentistry in a 4-year curriculum. We might have a half-year long lecture, and then we get like a month of clinical work. So it's a very small amount of training. And so really that does not put us out of regular veterinary school training. It doesn't put us at the caliber of what a human dentist has for people. So it's really nice to keep that understanding in scope, so that if people have the opportunity to find a dental specialist in their area, and they generally are, the, price point for their procedures will be higher, but they're worth it. I mean, the quality of work and the ability of what they can do for pets is going to exceed what typical veterinarians are going to be able to offer.
That's a very good point. And I know I've had my pets, goodness gracious, I don't even know how many dental procedures I've paid for with my pets, especially because I've primarily in my adult life had cats, and cats are just a different beast. We can do a lot of the same things. I think it's just more difficult. And then, of course, in this process of learning, from going to a more traditional mindset to a more holistic mindset, my cats have certainly been there with me through all of that. So I certainly, like, the first half of their lives, they're all seniors now. The first half of their lives, I was under the kibble cleans their teeth, because that's what my vet said. They, that whole fallacy that I thought
Yes.
was true for so long. But I don't, maybe you want to speak to that because I didn't even think about that before we started.
Yeah, that's actually, I'm glad you brought that up because sometimes I almost forget that people still think that. And it is a common belief because it was, perpetuated by veterinarians for decades that, people sort of just intuitively, although wrongly, thought that dry food would help to clean the teeth. And indeed, there were studies back in the 90s to prove that that was not true. And they looked at pets that eat, wet food and moist food versus pets that eat dry food. And there was no difference and this was before, a lot of raw movement. So this was just, probably standard wet food, not raw food. Because we know, you and I know, and probably all of your listeners at this point too, that a pet eating raw food should have, in general, better dental health than a pet eating any other, type of processed food, whether it's canned or dry. But we definitely know that wet food and dry food, there's no difference in gingivitis scores. And that's what's more important than even the tartar on the teeth. And so if dry food was going to help anything, and that's a big if, all it would do is maybe crack a little tartar off the crown of the tooth. But that doesn't matter to the health of the animal because unless you get at the gum line, unless you're rubbing along the gum line and, getting things cleaner there, then it's just tartar on the tooth itself is a cosmetic issue. It's not a health issue. And so really we need something that's going to more affect the gum line. And we know that dry food doesn't do that. It's not going to rub up on the gums. And to be honest, everybody knows most pets don't really chew dry food anyway. They might crunch one out of every, handful of kibble that go down. Some dogs don't crunch anything and they literally just swallow everything whole. So dry food definitely is not helping any of our pets for dental health or anything else for that matter. And dry food generally is going to have a higher carbohydrate load and obviously the heavily processed ingredients. Those things are going to drive more dental disease and more bad oral bacteria that we don't want in there. So dry food actually promotes dental disease rather than helping it. So I love to bust that myth for everybody that removing dry food from your pet's diet entirely is absolutely not going to decline any kind of dental or oral health. It will actually help it.
Awesome. Thank you for that. Because I forget that sometimes too. And then it'll pop in my head. Like I'll be talking about my cat
for people
and it'll
to know.
pop into my head.
Right.
But okay, so you mentioned, and I think this is going to be very, very important for so many people. You mentioned that if you're not affecting the gum line and below the gum line, that what's the point, right? Basically.
Yep.
And one of my biggest pet peeves for so long has been these signs that go up in front of pet food stores that are like, bring your pet in for this non-anesthetic dental, next Saturday or whatever it is. And it has literally, ever since the first time I ever saw one of those signs, I'm like, what are you doing? This is in my mind, it is a waste of money. It is unnecessary anxiety to the animal. And you're not even going to do a good job. You can't get under the gum line and they're not under.
Yep. I am so glad you brought this up, Jessica. And it was the perfect segue. Good job for tying that in. And now, telling all of your listeners that, it's the gum line that matters. So we know that, dry food doesn't rub on the gum line, but that's also a great way to segue into what is happening with non-anesthetic dentistry. Because just like you, Jessica, when I see those signs, I cringe. And I do get to really sort of bust that myth or that understanding with all of my clients when I get to speak to them directly too, because most, obviously well-meaning pet parents, well-intentioned pet parents want to avoid anesthesia as much as possible. And so they would often gravitate towards anesthetic-free dentistries, believing though that is giving their pet health value, because otherwise why would they do it, obviously. So it's really nice for you and I to clarify for everyone today that non-anesthetic dentistries very rarely are giving any health value. And if they are, it's generally very minimal. Okay. And sometimes it's zero. And sometimes it's actually doing negative, because it's possible that pets can get injured too. So you have an awake pet, and unless this pet is very tolerant and you have a very skilled pet hygienist, which oftentimes is not the case. The majority of people out there doing these teeth cleanings have very little training, like literally a weekend seminar. I mean, this is, now I do know there are some human hygienists that have gone over to, I'd rather work with animals than people, that's, and so they're doing, pet dental cleaning. So if they were trained as a human hygienist, that would definitely be a huge step up from somebody who just had this really, minimal training. But even then, even when they know what they're doing and they know how to do it, the potential to take an awake pet and to be able to curette or, scrape, we call scaling the teeth, scale the tartar and the plaque off of the teeth at the gum line and up into the subgingival space. So we want to get up into that. In a proper subgingival space for a dog, it could go as deep as 3 millimeters, which, by the way, is the same sulcal space for a human, gingival sulcus in a human. Cats shouldn't go any deeper than 1 millimeter. Dogs can go up to 3 millimeters and still be healthy or normal situation, but oftentimes the pockets are way deeper than that. They're 5-6 millimeters and beyond, and you got to get up there. And if it's deeper than 6 millimeters, you can't even effectively clean it, even when they're under anesthesia with a curette, or, those ultrasonic scalers. And so if anything's deeper than 6 millimeters, it needs treatment. It either needs a gingival flap to get in there and treat it appropriately, or it needs extraction or some other, more advanced procedure. So point being with the non-anesthetic is they need to get up there under the gum line and get that crap out, the plaque and the tartar and all the bacterial junk that's hanging in there, and really flush that out, and then polish the teeth, etc. So not only do you need to get up under the gum line on all, what we call the cheek or the buccal side of the teeth, but what about the lingual side, which is the tongue side on the inside? They're going to go in there on the inside by the tongue and be able to get up into all those gingival spaces around every tooth margin. I mean, that's really nearly impossible. And you've got these sharp curettes. So again, if the animal moves, if their tongue moves, if whatever, I mean, you can, and so, pets can get injured, and it does happen, or something in the mouth will lacerate. So that's really important. And the other thing that's important is they also should be probing with a periodontal probe. Protocols are to probe 6 spots around every tooth. This is what our dentists and our hygienists are supposed to be doing for us too. And most of them do, but I know that there are some offices that aren't even stellar at that for humans, where they should be probing in 6 spots to see if that probe is sinking deep anywhere, because periodontal pockets can be hidden and there can be abscessed, teeth that are just on one aspect of the tooth, and you really have to find that. If it is found for an animal or a human, the next step is to x-ray that area and to take x-rays and see what's going on, because without a dental x-ray, then we don't know what is the appropriate treatment to get that pet's mouth, healthier. And again, there's no way you can take a dental x-ray of an awake pet. You have to put this x-ray plate in their mouth. They have to sit there, that just doesn't happen, and they could bite down on it and, et cetera, et cetera. So, I am not a fan of non-anesthetic cleanings. What I really like people to understand is that generally, at best, what you're getting is a cosmetic procedure. The teeth, if you have somebody who's good at cleaning the teeth and you have a tolerant pet that's going to allow it, they'll come out on the other side with cleaner looking teeth, but the health is not improved, because under the gum line, there's still disease lurking. And I have personally seen many pets that have come into my practice over the years who have very clean looking teeth. The crown is the part of the tooth we can see. And then, under the gum line is the root. The crown will look very clean, but the gums are angry and red and purple and inflamed. And I'm like, or even there's exposed roots, like the gingival, we call it gingival recession. The gingiva has receded up because the disease and the inflammation is so chronic and yucky that there's roots exposed. So I've had pets where the teeth are very clean, and I'm sitting there looking at the roots, and the gums way up there, and they're all angry and red. And I say to the pet parent, wow, there's big time dental disease, but the teeth are clean. They're like, oh yeah, because I go every month or every other month for anesthesia-free cleaning. I'm like, well, did they tell you there's a lot of disease in your doggy's mouth? And they're like, no. Oh, well, yeah. And then sometimes they're like, yeah, they said there's a tooth loose and that, I probably should get that looked at, what I mean, it's just like a lot of stuff is not getting taken care of appropriately. And then pet parents are getting the false understanding or false belief that they actually did something that was of health value for the pet. So bottom line is, Jessica, I absolutely agree with you. I think it is not a wise use of money. I think that it sets the stage for pets to have a very stressful time often. And, you're not getting any value out of it. So I would much prefer to invest that money in either a proper, veterinary professional dentistry and or more proactive stuff. And, somewhere in this discussion, we can talk about that because obviously as a holistic veterinarian, even though I'm big on dental health and taking care of dental problems with appropriate conventional medicine and surgery when needed, I'm also all about being as proactive and integrative as we can to support dental health. And that's the empowering steps that we can give to people as well.
Absolutely. And I do want to talk about all of the because there's a lot of things that can be done preventatively for our pets. And I just want to say, I can't imagine what these pets are going through that are going in for these non-anesthetic dental cleanings, because I can't even, like as a human, you would think we have enough composure and willpower. I can't go to my see what I'm thinking. I can't go to my dentist without like I have to be on something. They prescribe me like Valium or something. I can't do it. They're working in my mouth, and but that also is, partly because just in my like growing up, I just never I've had so much dental stuff, like procedures.
Right.
I've had braces twice in my life. Like I was not gifted by God with wonderful.
Daunting. It's nice that you brought that up, because when you really put yourself in a pet's shoes, well, they don't wear shoes, haha, pun there. But, when we really imagine what pets are going through, it is very nerve wracking. And, even there's people like not only the emotional stressful part of it that you just described as, sort of you've experienced too, but even the sensitivity of the gums. Like there's a hygienist, good hygienists will often say, how sensitive are your gums? Would you like me to apply some topical anesthetic before I start digging around with the curette or the ultrasonic scaler? Because some people like, I'm pretty hardy, my gum, and I was like, nah, you can skip it. I don't need that. But some people, I've had hygienists tell me that unless they do that, some people literally can't even sit there and let you do it. They're jumping in their seat. They're super sensitive, and then you think about even just keeping your mouth open that long. Keeping your mouth, the pet has to keep so again, when they're under anesthesia, the stress is not being experienced by them. The practitioner or the hygienist is able to see everything and do everything appropriately. The pet's able to have the mouth open without having to, force it. So it is, it is so important to understand all those factors and, little pieces of it all.
Yeah. So, ideally in a perfect world, we're all gifted these beautiful puppies or kittens, and we start out immediately with all of the proactive, dental hygiene things that I know you're getting ready to tell me about. That's, obviously we don't live in a perfect world. And if your pet is experiencing, like they do have dental disease going on, they do need to have we say teeth clean, but it is their teeth, but like really the gums and everything, they need to have that done. So can you give me some of these like proactive things that pet parents can do? And then do you recommend like having that anesthetic dental procedure done and then starting these things like right away, or like giving them a little break after? I guess it depends on the severity of what needs to be done. Yeah.
Right. Yeah. And I love how you led into this question though, too, Jessica, because that is a really good nugget that I'd love everybody to take out of this discussion is the nomenclature, the difference between a teeth cleaning and a full dental procedure, which is the technical term is a prophylaxis or a prophy. And even back in the day when I was growing up, I mean, they used it like dentists would commonly say like you're coming in for your prophy. We kind of knew that word, but I think it's really fallen out of, trend where people today probably your dentist never even says prophy anymore. They just say teeth cleaning. So you're coming for a teeth cleaning, but it is so much more than that. A full dental prophylaxis for a pet or a human is doing all the things we kind of just said. You're getting in there, you're curetting or scaling around, under the gum line, on the teeth. You're cleaning the tartar off the crown as well. You're probing all the pockets to see if anything's wrong. You're flushing out the sulcus from any junk that you've just freed up by the curette. And you're taking x-rays of any suspect places. That is a dental prophylaxis. That cannot occur with non-anesthetic dentistry. So it's really nice for people to understand that when you are paying for a dental procedure for your pet, it is not just a quote unquote teeth cleaning. It is a full dental prophy, which is far more value than just a cleaning. Because if you just clean the pet's teeth and called it a day and woke them up and it's like, okay, good, you've missed the bulk of a big portion of the value is in getting in there, getting under there, finding any pathology, and then recommending the appropriate treatment to take care of it. So that's that side of things of yes. And I guess I can answer this question now, and then we can go back into the proactive is when is it appropriate to have a dentistry for your pet? That is obviously variable, everybody's an individual, etc. However, I can at least mention that there are certainly trends, and most people who have had multiple dogs in their life would probably already know this just from their own personal experience. But there are trends in the fact that small breed dogs, and especially toy breed dogs, like little bitty kiddos, are in general going to get more issues with dental disease and earlier advanced stages of dental disease, like earlier in life. And so veterinarians sort of lovingly joke about, Yorkies are going to lose all their teeth by the time they're 5 years old. And so I joke with my clients, like when they're asking, I have Yorkie or little, and they have dental disease. And I'm like, I'm so sorry, your kiddo's so cute, but they are the poster child of dental disease, so it's just something to be very aware of, that if you have a small or a toy breed dog, I would highly recommend that you get really conscientious about being as proactive as possible, as early in life as possible, even when they're young and they don't have any dental problems yet. Start brushing the teeth, start, doing some good oral care to preempt, that oftentimes progression that we see of dental disease in these small breed dogs. And we don't know, part of it's probably genetics, by the way. Part of it is definitely anatomy. Certainly any brachiocephalic dogs. So any dogs with short faces. So, your Bostons and your boxers and your Shih Tzus and your, all the little short faced kiddos. They're deaf pugs. They're definitely going to have more dental issues as well. They're small and they're short faced. So you got all these teeth smashed into a short face. So, you think of a German Shepherd or a Lab or a Collie or somebody with this long face, and they all have the same. Dogs have 42 teeth, cats have 32 teeth. So, they still have to, organize these teeth, obviously in the skull. And so when you have larger dogs, generally there's going to be less crowding of teeth and less plaque and tartar that's sort of smushing up in there, in between the teeth. And so in general, a small breed dog and certainly a brachycephalic dog are going to get more advanced problems. So more proactive quality of dental care for them would be awesome. So when it comes to professional cleanings or prophies, those small breed dogs really could sometimes benefit from every 6 months, and it depends on, of course, their other qualifying health status. Do they have a good immune system? What kind of diet are they on? Clearly diet is going to play a huge role. So if they're eating heavily processed food with lots of carbs, definitely every 6 months kind of thing. But depending on the individual, maybe annually, maybe every other year. Often large breed dogs might be able to go every other year, that kind of thing. But in general, when you're looking, or a veterinarian is looking to discern from an oral exam when a pet should get a dental, it should be more based on what the gums look like how much gingivitis there is, then it should be on the level of tartar on the teeth. Because again, the tartar is cosmetic. It's calcified, it's hardened plaque. It's plaque that's been sitting there. But if it's on the enamel of the tooth, not doing much. But when it's at the gums, that's the big issue. So once there's gingivitis and the gums start looking angry or red or inflamed, or the gums bleed easily. If your pet's chewing on a relatively, not like a super hard thing and their gums are bleeding easily, first sign of gingivitis for a human or a pet is gums that bleed easily. So those would all be reasons where you would want to get that professional dentistry done for them.
Perfect. Yeah, I am so interested in the tips you have for preventive care. It's actually one of my big, I don't want to say New Year's resolutions because I hate that, but like something that I know I need to pay more attention to, specifically in my dog. She's 10, and even though she has been raw fed since I adopted her, which was like almost 8 years ago, she is just a little princess and she doesn't want to chew on bones. In fact, like even the pre-made raw that I buy her, if it has too big of pieces of chunks of bone in it, she won't eat it. It's like she's just a little princess when it comes to that. So sometimes we just have to be more creative. And so what are some of these preventive techniques that you can share with us?
Awesome. Absolutely. And I love that you let in with the bones. We might as well talk about that because that is a great piece of the discussion for everybody to hear as well, is what is appropriate for bones. You did mention so astutely that not every dog is a good match for bones for various reasons. Some maybe won't chew them. It's just not their thing and they're not, attracted to it. So we find, other options for them. Sometimes it's because they gobble everything down and swallow it whole. And so I always tell people you don't want to give your pet a bone or even another chew kind of toy or chew item, especially for the first time. If you don't really know their habits, you don't want to give them something and then walk away and not be, monitoring them and observing them, because some dogs, literally you give them a bone or a chew toy and they will swallow it whole. And people have had to save their dogs by literally going down their throat and pulling stuff out so they don't choke. And so that's really important. And then when it comes to the texture of the chew item, again, there are things that are risky and dangerous to damage the teeth and injure the mouth. And there are things that are much more appropriate and have a higher, a high safety level. And so it's really nice to address those. When it comes to bones, one thing that everybody should know is that raw bones, of course, are species appropriate for dogs and cats in the fact that evolutionarily that is part of their diet. They would be consuming raw bones if they are fending for themselves in the wild. But in general, you are going, a animal in the wild or a domestic animal that's on the loose and has to fend for themselves is going to catch something that is an appropriate size prey for them. Okay, so you might have a dog or a cat that's eating a rabbit or a bird or a mouse or whatever. Generally, you're not going to see a little feline chewing on, a cow femur, right? So take that into account. But in general, raw bones are very safe, meaning that raw bones, if it's an appropriate size for their teeth to be able to eat, that is going to just chew up, grind up, and digest normally. If it is a cooked bone, when people cook their, food, when people cook food, then the texture of the bones will turn brittle. And that's where bones can become dangerous to digest for pets, because something that's brittle can splinter and break when they're consuming it. And then it could potentially perforate the gut or the intestines, et cetera, et cetera. So oftentimes, obviously dogs have gotten away with it plenty. They'll get some cooked chicken bones or whatever, and they'll, the majority of the time they're likely going to be fine. But you do run a risk. And obviously there are dogs that have been injured or even fatal cases of they consume cooked bones and it perforates their gut and they, get very, very sick and could, demise from that. So we want to be very careful in the kinds of bones, raw bones. We also want to select bones that are appropriate size for them, so, and then the other thing to know is that, again, generalization trends is that if they're hard, they're very hard objects are going to be much more risky to break the teeth. And so things that I should call out are antlers and hooves are some of the most risky items that you can give your dog to damage their teeth and break teeth. And it's estimated that at least 1 out of 10 dogs, at least 10% of dogs have a broken tooth in their mouth already. Okay. And they go unidentified a lot because it's difficult for veterinarians to see on an oral exam with a lot of dogs. And then unfortunately, a lot of general practice vets that aren't dental specialists, depending on when they were trained and how much dental education they had in veterinary school, they may not even know that broken teeth are a problem. And they definitely are. They lead not only to pain, they're painful, but they lead to potential, eventually, an abscess and a tooth root infection, et cetera, et cetera. So broken teeth are a problem. We want to avoid things that are really hard. And so you do want to avoid antlers and hooves. Bully sticks, way less likelihood, but could potentially, but break a tooth. Nylon bones, those are very, very hard, and they're marketed for dental health, and they're awful risk to damage teeth. So definitely I would avoid those. What I like to tell people is veterinary dentists will say that a good rule of thumb is a safe chew item as far as damaging the teeth or not, is if you can bend the chew item, the bone or, the toy, with your hands or dent it with a fingernail, then it's not hard enough to damage the teeth. But if you can't bend it or dent it with your own fingernail, then potentially that could be stronger than the tooth, where the tooth is going to give way before the item does. Okay. Now that said, statistically, it is more likely for a long, thin item to break a tooth. And the reason for that is when dogs chew on stuff, they're generally using what we call their cheek teeth to chew, which is these big upper premolars and molars in the back. And they're sitting there and they're gnawing. And so if they're holding a nylon bone or an antler or even a bully stick or whatever, they're sitting there gnawing. If it's a small, thin item, then they have a lot of space for their teeth to come down and crunch on that. Okay. And if that item is harder than the teeth, they have a lot of jaw force and they come down and then the tooth could give way. Now, if in contrast, they're chewing on a large knuckle bone or marrow bone or something that's occupying like a big old space where they don't have as much jaw space to come down on it, they're just less likely to break a tooth on those. So you could have a larger, bulky item that's a little harder that might actually be safer than something that is thinner and longer and hard. Those would be like the big risky things. So it's nice to go through that discussion of, chew items. The other thing I would say is there's definitely things that are made that are helpful and safe in things like, obviously, I think most people are familiar with Kong toys. The standard Kongs, a lot of times people stuff those with food, which is awesome because dogs will lick out, whether it's frozen peanut butter or pumpkin or sometimes people even feed their dogs in Kongs to give them some enrichment and some, time to eat things rather than woofing their meal right out of their dish. And that's all wonderful. They may or may not, certain dogs may or may not chew on that, but the Kong brand does make a chew item or chew toy called a dental stick. And I should have had it. I have one for my dog Sage, but I didn't bring one to show for a little demo. But the dental stick is like a round cylindrical shape rather than kind of that, triangular shape that the typical Kong is in. And it's got little grooves and striations that surround the whole circumference of it. And then it's got a center, an open center that you can stuff. So you can stuff little treats, freeze-dried treats, air-dried treats, whatever, in the grooves around it. You could stuff the center of it. And it takes some effort for them to dig those things out of the grooves with their teeth. So A, it gives them something to do for a while, which is super awesome. And B, those little grooves have little striations, but just with that, heavy duty rubber texture. So it's not going to injure their gums. That's going to rub on the gum line. It's going to rub on the gum line, or more likely to rub on the gum line than a hard chew item would when they're chewing. So I really like those, or something similar. Okay. Where you're stuffing it with treats and they can, do some self-cleaning, what we call, active cleaning. And so then passive cleaning would be, we're doing it for them or whatever. So other proactive things, let's move into that category. We know everybody's going to be interested in that. And these are such important things to be aware of. So Toothbrushing, definitely have to cover that, is that obviously brushing the teeth, still pretty much the gold standard in dental care, is actively getting in there and brushing clearly your own teeth, but obviously for our pets, brushing their teeth too, to the best of our ability. So I love to tell people, start young. When you get a puppy, or, even for amazing, superstar pet parents that have kitties, some kitties, I have clients that brush their cat's teeth. And of course, by and large, it's going to be a more challenging issue to do that with a cat than the average dog. But there are a lot of cats that will tolerate toothbrushing, especially if you start young and you start wisely with it. And so I love to tell people, start as young as you can to get them used to it. So before there's an issue down the line, they're very tolerant of this. And when you do start brushing their teeth, start really slow, like literally just, whatever you're going to use for a toothbrush, make sure it's a soft bristled brush, that it's not hard bristles, and you're not going to be, damaging or, injuring the gums, or even just, causing pain to the gums, because that's not comfortable. So something that's very soft bristled. Some people will use finger toothbrushes. But also just start with like a second or two, like literally just touch the front teeth with it, and good doggy, whatever. And, follow it up with something positive, a treat, or, really great reward, incentive, and then, build on that. So I would not recommend the first time you try and brush your pet's teeth to try and brush the whole mouth. It's going to be a really daunting experience for them. And then they're going to run every time they see the toothbrush. Definitely follow up with something positive. I brush my dog's teeth, Sage, my yellow lab, nearly every morning. And I follow up with some treats that I put supplements in. And so she gets her teeth brushed, then she gets her 1 TDC. We'll talk about that in a minute. That gets applied to her gums, and then she gets treats after that. So that's a really nice way of doing things. And so I talked about the soft bristle brush. Obviously, there's a lot of toothpastes that are, out there on the market that are natural ingredients. Obviously, those are things you would want to use. Pet safe toothpaste, obviously not, most human toothpaste would not be appropriate or safe for a pet. I'm a big fan of using coconut oil. Okay, so I love to use coconut oil and put that on a tooth. Even coconut oil by itself, without anything else in there, is very therapeutic to the gums and the dental health, and it tastes good. So dogs, pets like it. Even cats generally are going to like coconut oil. So that's a really nice thing to do. Essential oils can be mixed in with coconut oil, or you can use the actual brand Animalio, which is Dr. Melissa Shelton's. She's a essential oil expert veterinarian, and she's got her line of essential oils, and she has a formula called Dog Breath, which is awesome. And coconut oil is the base. And then there's 4 essential oils in there that include helichrysum, myrrh, copaiba, and peppermint. And that blend is phenomenal for not only breath, but for addressing bacteria and inflammation in the mouth, etc. So those are kinds of things that can be used. Probiotics can be rubbed on the gums. That's another really good way of addressing, the bad bacteria. Some people will make homemade toothpaste with probiotics and coconut oil and baking soda and, even cinnamon and things like that. So there's some fun recipes out there, and I do have some. And then I can talk about a few others. I don't know if you want to interject with any questions or lead-ins for me, Jessica, but I do have a few other products that I would love people to be aware of as well.
Yeah, and I think some of those other products are probably a little more passive, maybe, because I know, if you do have an older pet, it can be we know we need to do this, but it can be a little bit daunting to try to figure it all out. And I know, I don't know if you have any special tips that you can give us for cats as well. I, mentioned earlier that, the first half roughly of my cat's lives, I did everything wrong, right? Did everything wrong. I thought I was doing everything right, but I did everything wrong. And I have one cat in particular that I've talked about on the podcast before, because last year he had been getting full dental under anesthesia cleanings every 6 months for a while, for a few years, because we have been dealing with resorptive disease, which I know we haven't brought up yet. And so it was just our thing that we were doing, every 6 months to stay on top of this. And it seemed like he had been doing really well, and my vet was like, let's go a year. I think he can go a year. We went a year, and in that year, as we were approaching that year, he wound up, his blood panel showed he was hyperthyroid, so we had to get that under control before I could put him under anesthesia. And then once we did get him back under anesthesia, they pulled 17 teeth. He has 6 teeth left in his mouth. And so it was a lot. It was a lot for him. It was a lot for me. It was very touch and go for a while, especially because the pain meds they gave me weren't working. I'm in Texas. I was also giving him CBD, but from CBD Dog Health. But I needed more THC, and I couldn't get more THC because of where I am in Texas. It was a whole thing.
Yeah.
So, I don't want pet parents to be there. I don't want them to get to that point because it's not easy. It's not fun for you as a pet parent, certainly not for them. It just happened that because he's hyperthyroid, he's like 8 pounds, and I'm like, I can't let him go a couple of days without eating, and he didn't want to eat because he was in so much pain. So it was a whole thing. So what are some of these preventive, maybe more passive preventive things?
Yeah. And, since you brought up the resorptive lesions, I mean, we can just speak to that briefly too. That is a very common dental condition for cats, uncommon for dogs, but it can occur for dogs too. But these resorptive lesions that they get where the tooth actually starts to erode essentially, and there's really no way to stop it that we're aware of to date. So when this does happen, really the only treatment for it is to extract the tooth. Okay. So there are, unfortunately, and usually once it starts happening, then it's a matter of time before, other teeth in the mouth become affected. So it is not uncommon for, cats to have multiple, teeth extracted for, that reason. We don't really know exactly what causes that condition. Certainly there is a lot of studies looking at a lot of suspicion that there's an immune mediated situation where, the tooth is resorbing or causing that resorption to occur. So again, anything we can do for our kitties or our dogs too, to support their immune systems. And now, too, I mean, the thyroid, and there's a lot going on with your kitty, and there usually is. There's a lot of layers to the onion of, when there's things going on in the body, there's usually multiple, sort of things that are overlapping. And the thyroid gland is very involved with immune regulation. And all of the the whole endocrine system is so critically important. And so if things are out of balance there, that could have also been one of the reasons why, the immune system is more challenged or struggling. But even when there's no identifiable, obviously, thyroid or other endocrine disease, I mean, resorptive lesions are very, very common. But again, anything that we can do to support our pet's immune system, which obviously starts with diet and fresh food and species appropriate diets, but also other good supplements that are, sensible and very supportive for good health. So anything from things like your omega-3 fatty acids, your fish oils, which are, by the way, omega-3 fatty acids, amazing for inflammation and also known to be very good for dental health and, gingival health. So that's one thing. Antioxidants, when we eat antioxidant rich foods or take appropriate supplements with those in them, then your antioxidants are protecting your cells from oxidation, which is damage. And so again, when your gums are being damaged, your teeth are being damaged, whatever, those kinds of ingredients or, supplements and or in foods are going to be very beneficial to set the stage for that pet to have and maintain a healthier mouth. So those are good things to do too. When it comes to kitties, as far as tooth brushing, I mean, again, I would just be, as choosy as you can and as experimental as you can to see what works for your kitty. Small little brushes that are made for cats or little, pediatric, even, as long as they're soft bristled, finger brushes might work. Again, just rubbing something on the gums. And again, a fresh food diet, huge, huge, huge in that factor for prevention for cats too. And then the other thing, which is amazing, for dogs and cats, is a product that I would love to just give a little demo. I have it sitting right here. This is one of my favorite dental care products that is super easy and passive to do. As long as your pet drinks water out of a dish, okay? And we can talk about other ways that we can support pets if they don't do that. But this product called Teeth. And there is one for dogs and cats as well, and one that's just for cats. I just happen to have this one, here, the one with just the dog on the box. But and this is the sort of 201 packaging, or 2.1 packaging, I should say. Their original packaging was in a bag. Now it comes in a box, and then there's a little glass vial in there with powder. It is a unique prebiotic powder that comes with a very tiny scoop, and you put a scoop in the drinking water dish daily. Okay. If you have lots of pets, especially with it, you could do it twice a day, but the standard just, prevention maintenance is once a day. This is a prebiotic formula of all natural ingredients that are helping to reduce bad bacteria in the mouth. So it's all about supporting a healthy oral microbiome. And so this product was developed by a human microbiologist, okay, who was looking at supporting humans with, issues with periodontal disease or preventing periodontal disease. And then they made a pet product as well. And this was several years ago. This product works extremely well, and it's got all natural ingredients. And what's happening is the prebiotics in here, there's a few of them that are supporting the good guys that we do want in our mouth to have a healthy mouth and to crowd out the bad guys that want to move in and cause periodontal disease. So there's some ingredients in there, vitamin B6 and L-arginine, that are supporting the good guys in the mouth. And then there's a notable prebiotic ingredient that is reducing the bad guys. And what it's doing is molecularly, it's mimicking sugar, which is so cool. So bad pathogenic bacteria, they're going to cause more decay and plaque and disease in the mouth, are generally going to be sugar-loving bacteria, which is why humans who eat a lot of sugar, children that eat a lot of sugar, pets that eat a lot of high carb processed food, i.e. breaks down to sugar, they are generally going to have worse dental disease. But even if you have a healthy diet, depending on your genetics and other things going on in your body, you still will develop, likely at least some depth and sometimes significant dental disease. And so this prebiotic ingredient is very attractive to the bad bacteria. They go bind to that molecule, but they can't use it for food. So they starve and they die off. So it's a beautiful way to get rid of bad bacteria. We're not attacking them with antibiotics and using, antibiotics in the mouth or systemic antibiotics and getting rid of good guys. We're supporting the good guys. We're competing with the food source for the bad guys. So when they're drinking that in their drinking water, it's going to tie up all the bad guys and start getting rid of them, and the mouth gets healthier. I have seen pets with horrific breath. We call it halitosis is the medical word for that. Really bad breath. That within a week of getting teeth in their drinking water, people are like, oh my gosh, their breath is so better. I could barely be in the same room with them before without gagging. And now I can let my pet lick my face and it's okay, So it's really neat knowing that when your pet's breath gets better, that absolutely is a sign that their dental health is better, because the whole reason breath is bad in the first place is because the bad bacteria are releasing those odors. So when those odors start to go away and decline, that you've had groups of bad bacteria that are declining as well. And that's really exciting. We also see gingivitis get better and gum health, start getting better. As I mentioned, it works for cats too. There's a cat version. The one high maintenance part about that, because that's pretty easy to do, is if your pet doesn't drink much water. Okay. Some cats maybe don't drink a lot of water. Some dogs that are especially small breed dogs that are on a fresh food diet may not drink a lot of water out of the, freestanding dish. So if that's the case, the best thing that I would recommend to do is to put this powder in a little bit of diluted broth or even diluted goat milk or something like that. But really, the creator, Dr. Emily Stein, says it should be about 3/4 water and about 25% of whatever the liquid food item is, broth or whatever you're using. Because if it's full strength food, then you're not going to get as much good competition for that prebiotic molecule to grab those bad guys, because they're going to have enough food to go grab onto. And so if you give it separate from food, or, a very diluted version of that, then it's going to work much better. It's going to have more efficacy. So if you do the diluted brothing, I would try to do it 2 or 3 times a day in between meals would be a nice goal. If your pets drink out of the dish, just put it in the dish and that's all you got to do. Super easy and very, very effective product. And it's made for humans, by the way. I use the human version, which is a little tablet lozenge that's like mint flavored that you let dissolve in your mouth and does the same thing. So
Oh, I didn't know they had a human version. That's interesting.
yep.
Thank you.
It's called Daily Dental Cares. Yeah, I was going to grab that and I didn't grab it to set aside. But yeah, I do that. And it says, on the human bottle, just so you know, it says ideally, I mean, obviously you don't want to take it with food because again, you'll get too much competition with the food for this product to be as effective. So the bottle says ideally do it right after you brush your, put the lozenge in and let it dissolve right after you brush your teeth. So I do it morning and night. And I love it. And I have clients on it that are like, oh my gosh, their dental health has gotten so much better to the point where their periodontist or their hygienist is really impressed. So definitely works for people too.
That's awesome. Do you have any tips specifically regarding the teeth? Do you like to put down one bowl that has it in there and one bowl that doesn't, or just?
That's a good question because it has very little flavor, but it's not a completely absent flavor. And there are some cats, it's rare for dogs, although I've had people tell me rarely, like their dog won't drink it. Most dogs don't mind it at all, but I definitely have had, people tell me their cats won't drink it. So you might want to put down 2 bowls and just see. If everybody in the household is fine with drinking it, then maybe you don't have to do that. But that's probably a wise thing to do just in case somebody has an aversion to it. You don't want them to get dehydrated. So that's a really good comment to share.
And just very selfishly asking this question, I already to my dog's water add trace minerals because I do spring, non-fluoridated spring water, and then I add trace. So is it totally fine to mix these?
It's to my knowledge, and I will check actually with the company, there should not be any interference. So I can't imagine that would be any interference at all. Because even when you think about it, sort of standard, not that we want tap water because there's a lot of toxins, but standard water, the minerals in there wouldn't be interacting with that. So I don't think if you're adding minerals that would make any difference at all. But I'm happy to hear that you're doing that because that is a really good practice to have as well, in remineralizing the water, that if it's reverse osmosis, etc., or putting minerals in your pet's food. And I do that, for my dog too, because most of us are, and our pets are trace mineral deficient. So that is a really good daily part of the regimen for their supplements.
Yeah. So those are all really great. I think, you had something called?
I have one more that I really like a lot, and that one is 1TDC. I know Dr. Karen Becker and Rodney Habib had a dental segment on their Inside Scoop within the last several months, and they discussed this product too because it was the one kind of premier known veterinary dentist did this clinical studies on this, and this works really well, and I've been using this for years. So it's called 1TDC. It's good for cats or dogs. Some cats like the flavor, but certainly it's a lot easier to please dogs. Many dogs like the flavor. It comes as a little gel cap. I can even show that too. That's heart-shaped and twist off. I cut it off because that's easier. But there is a thick gel contents in there. And it is they call it an esterified fatty acid. 1TDC is just an acronym for the type of fatty acid that's in there, which is very hard to say, 1-tetradecanol complex. So it's a mouthful. So that's what 1TDC stands for. It's kind of an odd name. But the fatty acid that's in there is different from omega-3 fatty acids, not the same. So you still want your omega-3 fatty acids, very good for the mouth and the rest of the body. But this particularly, this formula helps to decrease inflammation and heal those tissues in the gingiva, in the gums. Interestingly, this 1TDC ingredient also helps for decreasing inflammation in joint tissue. So on the bottle, it'll say oral health and mobility. So it treats both. So it's a win-win for joint support and mouth health at the same time. So that's its big assets, is that naturally with natural mechanisms, it is helping to decrease inflammation in the mouth and in joint tissues as well.
And you just squirt that on the food?
Yeah, so thank you for asking. So once you open the cap, you can just spread it out along the gums, like just squeeze it along the gums. You could put it on your finger and then do that if that's easier, especially with a kitty maybe or somebody with a small mouth. I like to, and I think the videos on their site show, you can just use the capsule and squeeze that and just lift up your dog's lip or down the lip. It's really easy to just put it on the upper gums, and that's really all you have to do is lift up a lip, squeeze it on the gums on both sides, drop the lip. You can even use your fingers on the outside of your dog's lip and just give it a quick little rub in so it kind of rubs in there, and then you're done. And they can eat the capsule. My dog is a yellow lab, so she's a Labrador, so she loves everything. So I let her eat the capsule. It's a gelatin cap that's obviously consumable. If you just throw this in the food and they just consume it whole and you're not getting it on the gums, it will work great for the joints because it's going to absorb systemically and go there. It will likely still do some work for the mouth. But if you open it up and apply it topically on the gums, then you're going to get a really good efficacy for the gingival health, the oral health, and it will still make its way to the joint. So then you get a win-win. So I always open it and put it in the mouth, but it still has efficacy, especially for the joints, by just consuming it from the food.
Perfect.
Yeah.
Well, my goodness. I
Lots of
feel
good
like there's
stuff.
probably still so much more to say, but
There is, but that was a really, really good, synopsis and of the highlights, of things that I think are really going to fuel people to have the knowledge to support their pets' dental health better, which equates to supporting their pets' health better. And I really appreciate this discussion a lot. I guess I could add, Jessica, for everybody listening, that my practice, integrative veterinary care, we do have an online store, which we did put together over the last year to really give people a nice resource to get several of the products that I like to, recommend and suggest for my clients and when I teach, in webinars and podcasts and things like that. So you have one place that you can go to rather than having to go find things in numerous areas. But we do carry these things if they would like to find them through my site.
yeah. And what is the URL? I will make sure to put it in the show notes.
Yeah, thank you. So our website is Int Vet Care. So it's INTVETCARE.com, intvetcare.com. So short for integrative veterinary, obviously. And then when you go to the menu bar, there's a shop page. And we've got everything that we commonly, dispense and recommend for our patients and beyond on that page.
Awesome. Thank you so much for your time and your knowledge. And I hope that people can really take away from this, if nothing else, just how important dental health is for the overall health of both you and your pets. Because I think we can often just forget about it. We're not looking at it. We're not staring at it every day. It's not like, we're watching our dog live down the hallway.
Exactly. Well said, Jessica. What a great closing comment. I will share with you, that veterinary dentists say that all the time, in that because it's a hidden source of inflammation. People aren't generally looking or able to look so well in the pet's mouth and see that. Whereas if that level of inflammation was rolled out onto their skin and it was this big, angry hot spot that covered, the whole leg, I mean, that's a lot of, inflammation area in the mouth that if people could see it, they would absolutely be addressing it to more of an assertive level. And so it's really nice for people to understand sort of that hidden quality of it and the fact that it is influencing and affecting the whole body. It's driving inflammation in all other areas of the body. So it really is a source of chronic inflammation. And the more we can do about addressing it and preventing it, our pets stay healthier and happier, and they have more vitality. That's one other tidbit I could add in real quick, is that oftentimes when people get professional dentistry done, and any disease that was in the mouth gets, lift it out of there, dental, whether there's extractions, whether it's just gum care that has to be done. One of the common feedbacks that I get to hear is, oh my gosh, my pet is acting younger. They're acting 5 years younger. Their vitality is back. I didn't realize their mouth was such an issue until I had it taken care of. And now I see my pet is thriving more. And wow, that was really worth it. So it is really nice for people to, get that perspective, because it's really nice to know that you're making that much of a difference for your pet.
It sure is. So if you are interested in any of the products that Dr. Katie talked about, please check out her website, intvetcare.com. Thank you so much, Dr. Kangas, for joining us today.
Thank you, Jessica. Thank you for everyone that's joining us. Take care, everyone.
Thank you so much for listening to today's episode. Make sure that you're following the show so you never miss an episode. And please take a moment to rate the show on your podcast app. I'd also love it if you'd share this podcast with your friends and family so that they can benefit from the information to help their pets live long, happy lives too. Don't forget to take advantage of this special discount as a listener today and get access to over 100 online videos and my online dog training, The Furry Family Coach. Just go to thefurryfamilycoach.com and use code PODCAST at checkout to get your first month for only $7. That's thefurryfamilycoach.com and use code PODCAST at checkout to get your first month for only $7. I can't wait to have you join and see you on the inside.